Every year, thousands of people die and thousands more suffer serious health problems from vaccine-preventable diseases. And in part, that's because of the complication and costly process of getting vaccinations covered by Medicare. But that is now changing. In this video, I'll explain. Now, for us to understand really the meaning and the significance of these important changes, I think it's good for us to look back and look at the past and see how Medicare was covering, and then you can really understand why we're so excited about these changes. So first off, Medicare, of course, began in 1965. And as you know, Medicare is broken up into two parts. Part A is called the inpatient side of Medicare, the hospital, skilled nursing. And the B is called the outpatient side, which covers outpatient and doctors as well as preventive services. So it's the B part of Medicare that has covered historically immunizations through Medicare. So it's the Part B side, but it's been very limited coverage because up to now, Medicare would cover through Part B the flu shot when someone got that if they went on an annual basis. Medicare also covered pneumonia shots. And I think that's usually, I think 3 in a lifetime people take pneumonia shots. But the point is, if they got a pneumonia shot covered by Part B, and then if someone was high risk for hepatitis B, then they could get the Hep B shot covered by Medicare Part B. And then when COVID came into our world, then Medicare began to cover the COVID vaccines as well. And so these have been the 4 that have been covered by Medicare. And the point is, there is no cost at all for anyone who gets those shots. In other words, Medicare covers those completely. All right, but there's other immunizations that are needful that save people's lives. And the problem with those, up until now, those are always covered by Medicare D plans. And this would be the prescription drug plan component of your coverage. If someone has an Advantage plan, they have a D plan included. If they have a supplemental plan, they have a separate, or what we call a standalone D plan. And the problem with vaccines covered by drug plans, and they were, is that drug plans oftentimes were subject to a deductible. For instance, this year, the deductible is $505. So if someone had immunization, they had to cover the first $505. And so that could be problematic for people that have, tight budgets, and so they had to have a deductible. After the deductible, the immunization could also carry a copay or even co-insurance. And again, the point is there was a tremendous amount of out-of-pocket expense, and this again was a hindrance for people getting immunizations beyond those 4. Okay, and that's what has changed. Now we're going to get other immunizations covered. I'll show you how that's going to work. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. So that brings us to the present day, January 1, 2023 and beyond. Here's the way immunizations, vaccination are going to be handled. Now, again, let's go back to our Part B. There's no change there at all. Those 4 that were covered are still going to be covered under the B of Medicare. So if someone's enrolled in Medicare Part B, flu shot, pneumonia shot, Hep B, as well as COVID vaccinations covered by Part B. But here's what changed effective January 1, 23, and that is the D plans. Again, D plans have covered immunizations, but it was always subject to a deductible, to co-payments, maybe even co-insurance. So again, out-of-pocket expenses. And so what happened is this. There is a committee that's called the Advisory Committee on Immunization Practices. It's part of the government and actually reports to the CDC. And they have made recommendations as to what immunizations they believe that people that are eligible for Medicare should qualify for under a drug plan at 0 cost. And so what happened was basically Congress listened to them, and when they passed the Inflation Reduction Act not long ago, they included those recommendations from that committee to be included in drug plans at 0 cost, right? And so what that means if someone's going to get a shingles shot now, they don't have to be concerned about any out-of-pocket expense. There's no deductible, there's no copays, no co-insurance. because it has to be covered at zero out of pocket. If someone is going to get the Tdap vaccination, which is for tetanus, diphtheria, and pertussis, that'll again be covered because it was recommended by that advisory committee to be covered at zero cost. If someone gets the meningitis vaccination, or gets the chickenpox vaccination, or the Hep A now, all those things now are going to be covered by the Part D plans at zero out of pocket. So that's the change. So when the Inflation Reduction Act was passed, Congress basically was saying we're going to eliminate any out-of-pocket expense whatsoever, whether it's covered by B or by D. The Medicare recipient will be nothing out of pocket any longer. And really the greatest news of all with this new legislation is the fact that this Shingrix, which is the very popular immunization for shingles, is now covered, notice, at no cost. Now this particular immunization actually is 2 doses. 1 dose is taken, and then after that, either 2 to 6 months later, the second dose is taken, and both of those now are covered at zero. Prior to this, these were costing anywhere from $300 to $600 per dose out of people's pocket, and so it's very nice now that's going to be covered at zero out of pocket. And again, shingles, a very, very serious disease, health issue. When people get it, it really is very, life-threatening and can cause some real serious problems for certain people. And so that's why we're very excited now to see that this immunization now covered by a drug plan at zero out of pocket. And so I think it's very obvious to us that now Medicare is just saying, hey, we care about these vaccinations, immunization, because not only are we here to treat medically necessary issues, but we also want to treat preventive issues as well. And that's why we like all the preventive services that Medicare covers. So in closing, what I'm going to do now that we've talked about the preventive as far as medications are concerned, immunizations, vaccinations, I also want to note some very important things that are covered by Medicare when it comes to other types of screenings, because I know my client base and others sometimes don't take advantage of these things. So I think it's very important for you to do so. The first thing I want to mention is actually what's called a Welcome to Medicare preventive visit. A lot of people aren't aware of this. This is something you actually have to take advantage of the first 12 months that you're on Medicare. Now, it's not a full-blown physical, but what it is, anyone that's eligible for Medicare is able to have this appointment with their doctor. It's basically a time to review medical and social history. They're going to look at your body mass index. They're going to check height and weight, your blood pressure. They do a simple vision test. They're going to talk about advanced directives if you'd like to do that, any kind of depression issues, talk about risks that could be in the home that may need to be changed. And they actually are going to take the time to give out a written plan for you to make sure you're aware of the things we just discussed, screenings and shots and those kinds of things. And so it's very important to take advantage of that Welcome to Medicare exam. Then after that, you have actual wellness visits that you're eligible for on an annual basis. This actually is a time for you to review your medical history, your current providers, your current prescriptions. Again, they'll check measurements, height, weight, blood pressure. They'll do a cognitive assessment to see if there's anything issue maybe with dementia, Alzheimer's, and then any kind of personal health advice that you have that you would like from them. They'll do that. They'll evaluate any risk factors and do, again, a schedule for any screenings and tests that you need to take advantage of. And again, they'll do that every 12 months after your first 12 months on Medicare. Now, also, people are not aware of this one. I think this is very interesting and very important for those that would have some type of risk for this. Medicare covers a one-time abdominal aortic aneurysm ultrasound for people that could be at risk, meaning this could be in their history. A man 65 to 75 that has been a previous smoker or present smoker can actually get this, and there's no cost whatsoever to get this aneurysm ultrasound.
Hey, my name is Marvin Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, medicareschool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the difference between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to medicareschool.com and watch the Medicare Essentials workshop.
Bone mass measurements for people that may struggle with bone density issues, osteoporosis, osteopenia, anyone that would be at risk for this. Medicare will actually cover a test once every 24 months and even more often if medically necessary. And so So people that would be considered candidates for bone mass measurements would be any woman that's been diagnosed to be estrogen deficient. If anyone had an x-ray and there's some type of a vertebrae abnormality, they can qualify for bone mass measurements every 24 months. Anyone that's on steroids, has hyperparathyroidism, they qualify. And the whole point is you pay nothing for that. And again, their whole point is they want to make sure they find osteopenia, osteoporosis, and begin to be able to treat that. Another wonderful screening is called a cardiovascular disease screening. And this is your opportunity for them to check your cholesterol and your lipid levels and those kinds of things, triglycerides. And they'll do this every 5 years as long as the doctor orders it. Then you don't have to pay anything for that particular screening. Cervical and vaginal cancer screenings as well. This include Pap tests, pelvic exams to check for cancer. All women with Medicare actually get these once every 24 months, every 12 months if they're at high risk, and again, they pay nothing. Colorectal screenings. Obviously, people have colon cancer, and colorectal screenings are trying to detect early to see if there's any polyps, and that those polyps that could turn into cancer could be removed. And so these are different tests that are for colorectal reasons. There's a variety of them. One's called a screening fecal occult blood test. Another one is called a sigmoidoscopy. That's kind of the full-blown one. People are eligible for that every 48 months if they're high risk, every 10 years if not. There's a variety of colonoscopies. There's a screening called a barium enema that someone can get every 48 months or 24 months if they're at high risk. But the point is these are paid for by Medicare at zero cost to you. Now keep this in mind. If you are going through a colonoscopy and they find a polyp and they're going to remove that, then there would be a cost for that. So if there's something beyond just the actual screening itself, then you could be out of pocket, could be a copay, could be coinsurance, could be a deductible. So that would not be part of the covered service at 100%. Depression screenings. Anyone on Medicare can have a depression screening once a year. Diabetes screenings for people that could be at risk for diabetes. If the doctor makes a referral, you can actually get 2 of these diabetes screenings, up to 2 of those every year. People that may be at risk for glaucoma, there's tests for that. Now, this is a test that's not totally paid for by Medicare, but it's you'd be only out of pocket about 20%. But if there's someone that's at risk for that, they can actually have that test every 12 months. Hepatitis C for those that may have been, drug users in the past, especially if they injected drugs. Anyone that had a blood transfusion prior to 1992 could be at risk. They say anyone born between 1945 and 1965 actually qualifies for a hepatitis C screening test. And again, if you have this risk in your life, then that would be covered as well. And I think those are covered on an annual basis. Mammograms for ladies detecting breast cancer early. Any woman that's on Medicare 40 and older is eligible for a mammogram every 12 months. And again, you pay nothing. Medicare Diabetes Prevention Program for those that have blood sugar issues, body mass issues. Maybe they haven't been diagnosed yet with type 1 or type 2 diabetes, but they would like to prevent that. Then Medicare, if you've never participated in that program, they actually pay for that as well. Prostate cancer screenings. This is a big deal for men. All men over age 50 would qualify for a prostate cancer screening. You get one every 12 months. That could be a digital rectal exam. It could be a PSA blood test once every 12 months. Now, keep this in mind. Medicare says this: after you meet the Part B deductible, you pay 20% of the Medicare approved amount for the digital rectal exam. So Medicare pays 80, you pay 20. But if you have just a PSA blood test, then Medicare will cover that once a year for you. For sure. And so the point is this: you want to make sure that we understand how it's going to work now with the changes moving forward from 2023 on when it comes to immunizations. But also these other screenings are available to you because you want to detect these diseases early, because there's a high likelihood of recovery.